Welcome, my name is Emily Quirk. I am the editor of the Exeter newsletter, and tonight we have our candidates for office in District 19, which is Stratham only, and our floterial, which is District 36, and that includes Stratham, Exeter, Newmarket, and Newfields. And just so you know, we're down one candidate, Patty Lovejoy, because of the storm, was stranded traveling. She couldn't get a plane flight home, I believe, so. She is missing this evening, but she has participated in other forums and has answered questions through the Exeter newsletter's candidate profile, which is available online and has been running in print for a couple weeks now. So hopefully that will give her an opportunity to share with you her views, since she can't be here this evening. But we do have our candidates for District 19 and District 36 here. Bob Goodman, a Republican to my left, is running in District 36. And after him is our three candidates for the 2 seats in District 19. We have Trinka Russell, Pat Abrami, and Tim Copeland. Tonight's forum is being co-sponsored by the newsletter and the Exeter Area GFWC, which is the General Federation of Women's Clubs. And hopefully these forums offer voters information on the candidates, get to know them prior to the election, and as another outlet for them to ask questions of their potential representatives in Concord. And as everyone knows, Tuesday is our big election day, and hopefully you will get out and vote vote on the candidates who kind of match up with your views or have the answers that you feel you connect with on the issues, and not, you know, party lines. Let's listen to what they have to say, and we'll have questions from the public, and we'll get to know them, which is what we're here to do. And I want to thank you guys for coming, and hopefully this provides you with some information for your voting on Tuesday. And any questions that were not answered here tonight, feel free to look in the Exeter newsletter for answers to those questions. We pose the candidates 7 questions in our candidate profiles, and they're all at seacoastonline.com if you want to look at them tonight, over the weekend, whenever. I encourage you to do so. So what we'll do is we'll get started with Bob here on my left, and we'll go down the end to Tim with our opening statements, and then once those are complete, we'll go into our Q&A.
My name is Bob Goodman, and I'd like to start off by thanking the Women's Club and the Exeter newsletter for sponsoring this forum and having us together. For me, it's the 3rd one that I've been involved in, one in Exeter and one in Newmarket, and now this one in Stratham. Emily would have had us in Exeter, but there were so many people that they ran out of seats, so she's kind enough to let us come over here into Stratham. But my reason for running really fits into what the issues are that we're dealing with in New Hampshire and the country for that matter today, and that is jobs and the economy. Directly related to that are taxes. A little on my background, I've been in New Hampshire for a little bit over 35 years. Spent 20, give or take, in Durham, and then the rest of that time I've been here. I've been living in Exeter. I'm married to Pamela, my wife, who's sitting in the back, so that when I mention her name, she doesn't have to be afraid to look at her. And I'm glad to have my daughter joining me tonight for this event. And my work history, I came to New Hampshire with Liberty Mutual back in the late 70s when we had one facility located in Portsmouth with about 400 or 500 people in it. And if we fast forward, we're now looking at buildings in Portsmouth and Dover with employees in excess of 5,000. And with that, my role with Liberty was directly related to the growth that the company had over that time. And I know at the very beginning that Liberty came to New Hampshire. Actually, they started moving jobs up here out of Massachusetts. And they did that for for many reasons, not the least of all the quality of life and the tax structure and the quality of employee that could be hired in New Hampshire. Just about every job that is currently residing in New Hampshire at one time or another was setting in Massachusetts. And so one of the problems we have is that over the last 2 decades, we've seen the most major tax source in New Hampshire increase, which is the business profits tax. And that is something that has to be dealt with. I think the last legislature started the process of dealing with that by reducing expenses, spending at 11% rate, or over $1 billion. And what I believe that does is sets the stage for the ability for the legislature to look at seriously reducing the amount of the business profits tax, which is currently at 8.5% and represents roughly 25% of the funding for both the general fund and for education. I think directly related to growth in the economy and jobs is increase in jobs, which will then directly relate to increase in revenues and will allow for some revisiting of spending that has been cut, some of which I'm sure we'll talk about tonight. But I think that's where we need to start. Thank you very much.
Thank you, Bob.
Hello, everybody. I did spend 2 terms in on Health and Human Services from 2006 into 2010 in the State House. My background is that I have been an RN for a very long time. Started out as a candy striper, worked as a nurse's aide, put myself through college doing that. Went back to school and have a degree in interior and architectural design, and I specialized in building homes for families. Usually, basically what I did was they would have someone in the family that needed accessible changes made, and that's what I would do. I also taught that, I taught a class on Universal Design and Americans with Disabilities Act at my alma mater, which was the New England School of Art and Design at Suffolk University for 6 years. And now I'm back working as an RN, and I hope to go back up to the State House. And basically, I would like to just name a couple of reasons why. I'm very upset about what's going on up in the State House. It has definitely changed drastically from, obviously, the democratic philosophy that we had when I was there. In education, we lowered the high school dropout age. They got rid of that, where it was from, it's down to 16 here again. Suspended the state scholarship fund, resulting in higher education costs. They established a study committee to allow the diversion of public money to fund students attending private and religious schools, and in funding of Planned Parenthood. In human services, they drastically cut or suspended many things. Children in need of services, which is called CHINS, Healthy Kids, the CHIP program, domestic violence, women's health care and family planning services, mentally ill and developmentally disabled individuals, Head Start, nursing homes, and Alzheimer's care, vocational and job training for unemployed. Allowed guns in the State House. They allowed guns on state university and community college campuses and in public parks, beaches, and athletic stadiums. Allowed any person 18 or older to carry and conceal a firearm without permit or a criminal background check. And allowed any person 18 and older to be able to stand his or her ground and use deadly force anywhere at any time that they felt threatened. These are things that none of these I would have voted for myself. I'm very deeply disturbed with the philosophy, how things are changing when we say that we want to have, this legislature and this leadership wants to have the federal government out of our business. They want to, right now, LaMontagne is talking about taking federal funding out of education, so that we can do a better job by ourselves. Well, that's millions of dollars. Where is that going to come from, and how are we going to do that? We cut colleges by 50%. We changed laws to fit the situation. I remember when I was a state rep, the Democrats were lambasted by the Republicans that it took 2 years, we were going to take 3 years to get rid of the waiting list for the developmentally disabled instead of 2. And we had reasons for that. So, but there was a law passed that we would never again have a waiting list for people with disabilities. Well, they rescinded that law. And now there is 150 people, I believe, on the waiting list again. I'm just very disturbed with all of these cuts, and I wonder how far do we want to go with not caring about the people in our communities, in our state. How far do we want to go with not educating our children? How far do we want to go with not caring for our elderly? When we have people in the nursing home in our state, our Rockingham County nursing home, they laid off a majority of the nurses' aides. Those are the people that take care of those people, feed them, they bathe them, they turn them and make sure that they don't get bed sores. They assist them in ambulating as much as they can so they don't wind up being immobile. Where are we going in this state that to the point where we're just going to be cutting all of these things and the way things are being done in the state as far as the cuts that were made, I think were drastically a big mistake. You know, the cigarette tax, I'm done. Okay, anyway, there you go. That's why I want to go up there.
Thank you, Trinka.
Thank you to the newsletter and Creative Federation Women's Club again for sponsoring this, and Emily for moderating. First, I want to say it's been an honor to serve you the last 2 years in Concord. I'm going to give you a quickie on my background. The palm cards over there have my background in detail, but I'm a resident of Stratham 29 years, live over on Tall Pines Drive, raised 2 children here, wonderful town to raise family, as it is a wonderful state. I have a BS and a master's in industrial engineering from the University of Buffalo, and I'm one of 4 partners in a healthcare consulting firm with national scope, and I've been with them for 38 years. When I ran last time, there were 3 ticking time bombs that I had talked about at this kind of a forum. One was the $800 million budget gap. There's revisionary history going on that there wasn't this gap, and it certainly was, and hopefully we'll have a debate about that later on. The Dems increased spending by 24%, we had to cut it back 11. Guess what? That's still a 2% increase every year for 6 years on the average. The other issue, big issue, this was ticking time bomb, was the unfunded pension liability in the state, $4.3 billion, which ranks us 8th worst unfunded percentage-wise. We took some actions this past 2 years to try to reverse that. There's still a lot more that's needed to be done. And we can hopefully talk about that today as well. The other big ticking time bomb was Obamacare, what it meant to Medicaid and what it meant to costs for every taxpayer in this state, including middle-class taxpayers in the state. And we did do Medicaid reform in the state. We converted it from a fee-for-service to a managed care. We hope to save tens of millions of dollars a year. By doing so, we were one of the few states left that didn't have managed care, and we finally got around to doing it. But the savings from that probably will not be enough to cover what is coming down the road in terms of Obamacare, in terms of Medicaid costs. But I want to spend the rest of my time just talking about me as a representative and what I do and what we do as representatives. I'm very active. I never miss. I'm always there. We vote on Wednesdays, on the committees on Tuesdays and Thursdays. I'm on the Ways and Means Committee. We hear testimony. And we exec bills every once in a while, which means we either vote them out, yes or no. And I'm always very active in moving bills. That means you have to write the summary of the action by the committee that appears in the House record. I always feel I want to hold my own weight there, and that's what I do. I chair 3 subcommittees this past year. One on Weights and Measures. I had Lorraine Merrill, who's Agriculture Commissioner from Stewart Farm, in my committee. We had to develop a new fee structure for Weights and Measures, which we did in a bipartisan way. We had a dispute between the hospitals and the surgery centers over a fee structure for infection reporting system. And my chairman, we weren't getting anywhere in committee, so they looked at me and says, "You're a healthcare guy. let's have a subcommittee, you resolve it. One meeting, we resolved it, we got a bipartisan decision and a solution to that issue. Keno, we had 2 Keno bills, and we were debating Keno after we got done with the gambling bill, and we had to form a subcommittee to look at it. I chaired it. I had Charlie McIntyre, who's the lottery commissioner, lottery executive director, attended. He was very anxious for Keno. He's Mr. Keno from Massachusetts, this guy. And I said, no, let's slow this down. We're all a little weary and tired, so we sent that out to study. But again, I was on these things. I filed a bunch of bills. The key thing about filing a bill is working the bill. I've met with the Commissioner of Insurance, the Commissioner of Environmental, Assistant AG, Assistant Executive Director of Elder Affairs on my bills to make them aware of what's going on and get input from them. On the floor, I'm very active on the floor of the House. I fought for my granny tax repeal bill for our Riverwoods folks, the CCRCs. On the risk pool, the LGC, which is out of control, according to the Secretary of State, there was a bill on the floor that I spoke to. It was almost unanimous on the floor for us to develop a bill to right that ship. And then, of course, there was the prescription controlled substance monitoring bill that I was very active on the floor getting that passed. We have county responsibilities. We do oversee the county budget. We have to go to the county and do those things as well and approve their budget. Then there's constituent services. We get about 70 emails a day and voicemails that we have to respond to. And I will respond to every email and voicemail from my district. I'm also out about 1 or 2 nights a week to different organizations that invite us. And I always make an attempt to, when invited, to go. And the only other thing I want to mention is that I like to communicate with my constituents. Exeter Newsletter has been very kind to allow me 900 words and an opinion piece anytime I have something I want to say, and I do take advantage of it. So I just want to thank you all for being here, and I look forward to your questions as we proceed.
Good evening, everyone, and I also thank the Greater Federation Women's Club and the Exeter Newsletter for having us here tonight in this open forum, letting the public be able to speak to us directly. As some of you know, well, first of all, I'd like to thank my wife, who's out here, Andra, over 25 years, who supported me in my government roles, which in the state of New Hampshire in the last 5 years. I've been a selectman here for almost 5 years. Before that, I served on the Zoning Board of Adjustment. I serve presently on the Town Conservation Commission and the Recreation Commission. I've been a member of the Volunteer Fire Department here for 10 years. I believe in volunteerism and I believe in giving back to my community, and I enjoy very much doing that. Because of my municipal background, I was fortunate enough to get on municipal and county government committee when I was in Concord the last 2 years and served on that. I was able to stop a lot of frivolous legislation from coming down, or at least vet it out properly so that when it did come to the House floor, it was properly vetted and there was justification in that legislation of money that would cost you tax dollars down the road. I was also the key sponsor of a piece of legislation which is now becoming extremely important on mosquito spraying, which Dave Canada helped put together with me. Basically what it was before was the governor would have to declare a state of emergency, Health and Human Services would have to get his memo. From there, the information would dwindle down. It took a while because of the government bureaucracy involved in that, sometimes 30 days, sometimes longer. And we were able to spray on state-owned land, but only for that year. We couldn't do anything after that. But we always had to ask permission from, for example, Fish and Game, which owns a lot of waterside property here in Stratham. Well, Fish and Game was very territorial, and at times they were like, well, we'll see what the governor says, even though we wanted to pay for it. So to make a long story short, I got the legislation in. It wasn't initially what I wanted. It had a 5-year window where if the governor declared a state of emergency, we had 5 years to keep spraying if we wanted to. They wanted to knock it down back to 1. We went to a review committee with that with the Senate, and I ended up getting 3 years, which is good for us. So right now we can spray every time he announces it. This clock starts again for another 3 years. that's really important here for Stratham, because this definitely presents a clear and present danger to our community. I believe in responsibility and accountability, integrity, honor, respect, and fiscal responsibility. I've proven my fiscal responsibility the last 5 years as a selectman here in your taxes. I've proven that this Board of Selectmen holds the line on your taxes. And we feel that it's our money as well, because it is. And we make sure that everything is accounted for and that everything is properly vetted, so that when we do account for something, or when we do appropriate an expenditure, it's the proper expenditure, and it's well thought out. The public should demand from its elected officials all the things I said: accountability, integrity, honor. It's important. And we see a lot of these commercials, especially now, when they're all attacking each other. Nobody's telling you what they're going to do. They're telling you what the other candidate did. It's not good. You're not getting the information that you need out there. All of you have entrusted us to represent you and deliver your message to Concord. And I believe a lot of us have done that already. Maybe not exactly the message that we wanted here from Stratham, but statewide that message was delivered. My platform in the last term, and I hope to continue that political philosophy, is to hold myself to a much higher standard and duty to you. Please allow me to be that rational, calm voice that I was the last 2 years, outspoken somewhat on the House floor on the issues, but for my constituency, and always for my constituency. I'll always put them first and foremost over party and leadership. I believe in that. It may be old-fashioned, but I believe that's the way we all started out before we had a big party system, and party systems ran things. I'll always work for you. So thank you very much. I hope to continue to work for you.
Thank you, Tim. Thank you, candidates, for your opening statements. It's good to open it up to the floor and have the public have the first stab at questions to our candidates. I have a list of questions if the public comes up short, but please come to the mic, state your name and your town and your question for the candidate or candidates, and we'll go from there. Do we have a first question?
First, I want to thank you for your service, because it is a service, and I appreciate your time and your efforts. My question is for all of you. It's a general question. In the 30-plus years that I lived in Stratham, Stratham, when I arrived here 30 years ago, was a highly partisan town. It's always been a highly partisan town. I think it's the nature of politics. But I think recently, the appearance anyway, is that politics has become not just partisan, but uncivil. So my question for you is, do you think that's a problem in Concord? And if so, what do you plan to do about it?
And that's a question for all candidates?
For all the candidates.
Okay. Why don't we, since we started our opening statements with Bob, why don't we start this question with Tim, and we'll come this way to Bob?
Sure, thank you. Thanks, Andy, for the question. Yeah, I totally agree with you that in my opinion, there's a lot of uncivility in the Concord. The only way to fix it is to not have the next speaker be Bill O'Brien. It's pretty simple. And we as legislators, whoever gets in after November 6th, we vote the speaker in. So we'll see what happens on the 7th when people realize who won and where they are. But that will bring back the civility. The speaker is the one that maintains that tone, if you will, and has a lot of power. The speaker puts the people in his committees, the people assign seating, and there's probably a lot of other things that I'm forgetting, but it's an important position, it's a strong position, and that's the only way I see it, is to have somebody that is more open-minded and reasonable and wants to work and play well in the sandbox with others.
Well, I'm going to take a different tack. For the most part, the House is civil. I wouldn't be running for re-election if I didn't think it was civil. The committees, let's talk about committees. The first thing we're instructed in our committees is to treat every person who testifies with respect. Thank you for coming, thank you for being here, thank you for taking my question. And that's followed, very civil. Same thing when I deal with legislative research or legislative services, they're very, very cooperative, very civil. When we meet with the governor, it's very good meetings, commissioners, very good meetings. I've had individual meetings with Bill O'Brien. I mean, I'm not in leadership, but he's always been civil to me. I don't know, you know, there are a lot of people who have policy differences with Bill O'Brien. A lot of policy differences. And yes, we're more polarized as a country and a state. I don't know if it's a state, it's a town, but as well as town, but it's on both sides. There's the polarization. Terry Norelli fights as hard as Bill O'Brien does for his side of the issues. And I don't think we've in the past seen that kind of leadership on both sides in terms of people who are as partisan on either side. But it's policy differences. And it's policy differences on the Republican side more than it is between Republicans and Democrats that has led to this incivility issue that's constantly coming up. And, okay, so Bill O'Brien has the big target on his back. I mean, would I handle things the same way Bill O'Brien does? Probably not. But all of us are different. Like I said earlier, I've consulted all over the country, and over 400, I've consulted in 400 organizations, and I've seen all different management styles. So maybe I have a thicker skin than some others do, but what can I say? I'll tell you, when it comes to Republican caucus meetings, where it's just Republicans meeting and Bill O'Brien is there, he's never once raised his voice, never once twisted anybody's arm in that room to say vote one way or another. I've never seen it. And on the House floor, our rules are such that Bill O'Brien just moderates, okay, or the speaker, whoever that speaker is, moderates. Any one of us can ask for a vote to overrule what he just did. And so it's somewhat civil place. I talked to some of the old timers. That's what I talk to everybody there. I'm friends with a lot of Democrats up there. I work well with Democrats up there. I make a point of doing that. But the old timers tell me stories like, well, there was once when there was a majority leader who disagreed with the speaker on the floor. Next day, that majority leader came to the State House, and his furniture was out in the hallway. Bill O'Brien doesn't do that. There was a time when you all heard about the Zig Heil incident that happened on the floor, and that was by a representative who basically is not a team player. He didn't agree. He thinks he knows more about parliamentary procedure than the speaker or the clerk, and Bill O'Brien handled that incident very well that day. He automatically got a committee together, one Democrat, two Republicans, to help resolve that incident. So, I get along with everybody. I try to get along with everybody, including the speaker. Thank you.
I think this kind of forum is a great opportunity for you all to decide who you want to elect. Sometimes you might not 100% agree with somebody, but if you think that it's the type of person that is going to be able to work with different personalities and different perspectives and ideas, that's who you want to elect. You don't want to think about a party. You want to think about that individual. And I'm going to tell you a perfect example of what happened. When I was in the State House, a bill that I received an award from the Governor's Commission on Disabilities for, that I put through, it was really important to me. I put it in my freshman year. And the Speaker of the House, I remember saying, you know, be very careful about what you do and learn the process first before you do these things. But of course I didn't listen. And I wanted this bill passed so bad. So my first term, I put in a bill. Actually it was my second year. I waited 1 year, and I put in this bill. And it was my inexperience that it wasn't done right. I didn't think it all out and through, and all the repercussions of it. I thought I did all my homework, but it wasn't really done well. But and it went to Commerce Committee. And when a bill goes to a committee, If they think it's something that is not something that they can vote on right then and there, but they like it and it has potential, they'll put it in what they call an interim study. Sometimes bills go there to die, but sometimes they go there for good reasons. And so during the summer, I worked with Republicans and Democrats in the Commerce Committee that were helping me or debating with me the bill, and what they found was not good about it. John Hunt, who was the chair of Commerce for a very long time, and now is again, he's a Republican, was giving me a hard time through the whole process. And I remember saying to him at the end of it, when it was all over and we had a bill together that everybody liked, I said, you were a pain in the ass through this whole process, but you've actually made it a better bill. Because it was a different perspective. It was a different side of a way of looking at something that I didn't see, you know, but, and you know, the more you discussed it or debated it in a respectable way, you can, if something is important enough to me, you have to make compromises, you know. So anyway, it went to the floor. 20-0 vote means that, and it was, it passed with a voice vote. That meant nobody debated this bill. So that's the way you get things done up there, is that you know the people that you can work with and you go to them. But I think the biggest thing is it's up to you guys. It really is up to the elected part, the people to research and listen to the people that are running and choose somebody based on whether they're not, it's going to be somebody that's going to do a job up there and work with everyone that's up there.
I guess I'm the only one here at the table, other than Emily, that has not been in the legislature. So, speaking to the specific question though about the civility, I agree. I would agree 100%. It would seem to me that that would be the way to get things done. Having been in the corporate America side of things, I think that's what we try to do. But I also know at the same time that you do have disagreements and you have firm beliefs about what you're trying to get done. And I'm sure, with the knowledge that I have of Bill O'Brien, I'm sure he fits that to a T as far as wanting to accomplish the agenda that he and the leadership that's in charge over there wants to get done. And from what some of the things that I heard that took place, I would take exception to that. And I think that going into this legislature, I think that people learn. But at the same time, I mean, I have, since this whole thing has kind of come around over the time that I've been running, I've seen examples of this from people that that are arguing against Bill O'Brien and the things he does. So we have a representative in Exeter who wants to be speaker and replace him. And I had the opportunity to read some of the stuff that he's put out on the blogs. I don't find that very attractive. Most recently, attacking Pat Abrami. I mean, that, you try to, of all things, to be calling kettle black and then turn around and do things of that nature, I think that just doesn't play. But the bottom line is, it really, there's a lot to be done. There's a lot to be done to get done and to get this state back on track. And I think that we've started that. Whether or not Bill O'Brien ends up being the speaker or Lee Kwan ends up being the speaker, whoever ends up being the speaker, well, that'll happen when it comes time to organize after this election. But I know that I'm going over there to represent the constituents from the 4 towns that I'm running in, and the things that need to be done, whether it's overregulation that's taking place, that we have communities of Exeter and Newmarket looking at exorbitant expenses to hire lawyers to counteract the level of regulation that we see from our own Department of Environmental Services, and then from there to EPA. I think that's what we need to be focusing on. We're talking about the millions of dollars we need for schools. Well, the type of stuff they're talking about doing in the Bay is going to cost the 5 towns that are involved in that anywhere, well, up to $550 million. That money can be better spent. So I know where I'm going to focus my attention, and if I have some issue with Bill O'Brien, I'll state my case to Bill Ryan, but in the long run, if he's the speaker, he's the speaker. And I think that, you know, we need to recognize the leadership, just like we would on any other company or any board that we serve on, and that's, I guess that's what comes with that job, so. Thank you.
Thank
I'm going to ask a different way. Since we are going to integrate healthcare from the Affordable Care Act, how will you be able to get bipartisan support for that? If you're in that. I mean, you had experience in your 2 terms, but now this is going to be a whole new unknown.
I don't know. It's going to be a very difficult one because it's.
Well, you don't know who's going to be.
I don't know who's going to be in there, and I don't know who will be in leadership, and
That's right.
it depends on a lot of things. I am absolutely 100% behind the Affordable Care Act.
So just talk a little bit about what it would mean to people. Because you don't know who your colleagues are going to be. Sorry, I didn't get through the question.
Whatever. Like I said, I have spent an awful long time in healthcare, and I see all the time how much more healthcare costs because people have limited or no healthcare, and they wind up waiting to go to the doctor. If they don't have a physician, they go to the emergency room. And we all have heard this 1,000 times. It is incredibly expensive there. But what's even more important is that there's no follow-through. So people will go to the emergency room, get care where it is expensive, and then not be followed through. Maybe they're diagnosed but didn't know they had diabetes. Well, they don't go to a physician, and they don't have the education on learn how to take care of that. So there is, the repercussions from not taking care of that. You know, you can have amputees, you can have blindness, you can have neuropathy. There's so many things just with that one disease that, and also, I don't think in this country, you know, they call it socialism. I just don't believe that that's what it is when it comes to healthcare. I truly don't. I believe it's something that's going to be successful, make everyone, help our economy, help businesses that may not be able to afford to have healthcare. It's going to drive, in my opinion, drive down the cost because we are all paying. We are, everyone that has insurance, paying for those that do not have it. And so that's, those, without a doubt, we are. And to say that, and to think that that's not true. I mean, if a hospital is going to charge more for something, and insurance, in order to give services for somebody, because there are people that are not going to get, they're not going to get payment from. I think when someone has cancer and has health care, and then there's another that does not, or my own experience. I have twin sons that have disabilities and they both get Medicaid. We have insurance. A lot of things that it didn't pay for, Medicaid paid for. That was, we did not get it until they were 2.5. So we had 2.5 years of experience of that fear of wondering how we were going to make those, pay our medical bills, and to think that we might have to do this for the rest of our lives. It's very difficult on families. It's a financial crisis and burden, and it's hard. And I don't believe that one family should be able to get assistance. We have Medicaid for our children, so we don't have to worry about that anymore. But what about somebody that has multiple sclerosis and is spending years and years not having good health care or good assistance because they don't have those medical benefits to help them, and they don't fare well? Is that right? I just think that for our economy, for this country to succeed, everyone has to be healthy. You have people that have small businesses that they do it themselves, and they're not able to do it well because of some, someone that I knew had a torn Achilles heel. He's a plumber. He's trying to make his daily living with something that was incredibly painful and difficult. So what I would like to do is try and talk like this and try and say that why don't we give it a shot? it's not working the way it is now, so why not try?
Actually, I agree with Trinka that healthcare costs are out of control, especially in New Hampshire. We have the most inefficient healthcare system around, and I consult in a lot of states in healthcare costs, so I know. And we've studied a lot of hospitals in the state. I'm not convinced that the Affordable Care Act is the solution, though. I don't see where it's going to reduce costs. It'll probably reduce access, therefore reducing costs, but I don't see it as the cure-all. And you know, your comment earlier about working together, bipartisan is the way to do it. We have a great example of your experience in the State House. But unfortunately, this Affordable Care Act was not a bipartisan effort. It was forced down the throats of even Democrats, okay? Cornhusker thing and the, you know, Louisiana Purchase, remember those things? They were buying off senators and all of that during that period. Because the senators knew, and those two issues were related to what I thought we were going to talk about here was what was the impact on New Hampshire in relation to Obamacare. And it has to do with the moving of the Medicaid eligibility up to 133% of poverty level, which would put some, depending on whose estimate you look at, some 30 to 50,000 more people on Medicaid. So the question becomes, how are we going to pay for that? Now, the feds say they're going to pay 90% for a bunch of years, and then it's going to go down from there. The problem is that 90% is 40 cents on every dollar. That 90% is borrowed money from China. What kind of solution is that? So and then my biggest concern about it, and we're going to take a thoughtful look at this, okay? And it's coming up. It's going to come up next year. We have to take a very thoughtful look at this. Is that who's to say that this 90% isn't going to decline, that the feds are saying they're going to pay for the Medicaid isn't going to decline faster, that it'd be 50% in 2 years. This has the potential of being one of the biggest unfunded mandates to the states, and that's why a lot of states are already saying they're not going to play ball. Now, the Supreme Court...
Patrick, you're
I'm sorry, I didn't see the gun sign. The Supreme Court said that we could do this. They said it was constitutional, but they said that the states didn't have to be forced to do this with the Medicaid increases. Thank you. Sorry.
You know, for your closing statement, because that's definitely a good place to continue more if you have more to say. Do any of the candidates have a rebuttal to this question that was directed at Trinka? No? Next question.
My name is David London. I've been a resident of Stratham for 32 years and a physician at the Exeter Hospital for 33 years. And I'd like to confirm what Trinka has to say. There's a study in the New England Journal recently that showed when Medicaid was expanded in Texas, the death rate of those people went down by 5%. So Medicaid is a good thing for people who don't have other forms of medical insurance. The Stratham Democratic Town Committee sponsored an essay contest in the 5th grade at the Stratham Memorial School and in the Exeter High School about the preamble to the Constitution. And I think this raises a good issue of why do we have government? Well, on the macro scene of the United States, the last few days we see why we have government, because one state that's totally inundated with water can't deal with the problem on its own. But the reason we have government is because there needs to be something that is effective when people themselves as individuals or corporations can't deal with the problem. And I think that healthcare costs, as Pat says, are totally out of control. I've been a recipient of payments from insurance companies and the state, and also a consumer, so to speak, of medical care over the last couple of years, as have other members of my family. My mother-in-law was in a nursing home for about 6 years, and in spite of the fact that she had worked all her life, had accumulated over $100,000 worth of assets, and had a disability insurance payment of $4,000 coming in every month, was totally wiped out, her finances, by the cost of maintenance in a nursing home, which was $11,000 a month. Nobody, except maybe Romney and the 0.001%, can afford to do that. I mean, I make a good living, and we couldn't afford to keep my mother-in-law at $11,000 a month in a nursing home. That's why we have Medicaid. And I think that it's very important that we go along with the Affordable Care Act and even amend it to make care more affordable for people. But I think that passing on Medicaid and not assuming the mandate that the federal government has said is a very short-sighted thing, because your parents are going to need that nursing home care too.
Thank you for sharing your story, David. Did you have a question for the candidates, or did you just want to share your benefits?
I've read in the newsletter where they stand, so
Okay.
I don't think they need to reiterate it, but I think that Trinka is the only one who supports the Affordable Care Act.
If we had to do a poll of the candidates, if you right now had to decide on it, who would be in favor and who would be against it?
Well, I'm not for it, but my mother, had a stroke and spent 6 months in a nursing home, and Medicaid paid for a huge amount of that. So I don't think this is a question of people being uncaring or not wanting to see people well. I think the question is, how are you going to pay for it? I mean, the government, we're $16 trillion approaching $17 trillion in debt. So I'm just saying is that I'm all for taking care of people, but the numbers are so mind-boggling. What are we leaving, for my grandkids or my great-grandkids, or where's it end?
Well, I think that people have a philosophy of what are taxes.
Well, let's not get into a debate here. Let's not get into candidates ask their question. It could be very interesting to them.
But that's what taxes are for.
I'd like to respond
Thank you,
to that a little bit. I truly believe that by insuring everyone, the cost is going to be going down because of preventive medicine. The cost of things get astronomical when someone is not treated for something until the very end, and then they have massive issues. It's not just diabetes, it's heart disease, it's possible blindness. With each with each medical issue, if you don't treat something, it becomes more expensive to take care of them. So the biggest thing is that I see with national health care would be the preventive medicine, lowering the cost.
Pat?
Let's have history tell us what really happened. Medicare, when it was enacted years in the 60s, when they went out 20 years later, they looked back, the estimates that they had were 5 times, the actual cost of Medicare was 5 times greater than they originally estimated. Same thing's going to happen with Obamacare. There's no question about it in my mind.
Excuse me, it's not Obamacare, it's affordable.
He likes calling it because the president himself is honored to have it called Obamacare, and it's a shorthand. Instead of saying Affordable Care Act, it's too short to say that. It's not insulting the president.
Thank you.
The president likes us to call it Obamacare, according to one of his debates recently. So, again, my business is in Massachusetts, and we've had Romney Care for many years. And guess what? Our health insurance rates have gone up 20% a year. 20% a year since Romney Care. And we asked, part of it has to do with Romney Care. So somebody has to pay for it. And guess what? Most of the people I have are middle class. It's the middle class that's going to be taxed on this. And it's going to be the middle class that's going to be taxed with. And if we go along with this Medicaid expansion, and the middle class is going to be hurt in here. Now, don't get me wrong. I'm all for reform. I think we need to do something with it. I just think that this Affordable Care Act is not the proper way to go. I think it needs to be retooled and relooked at, and it has to be done in a bipartisan way, and it should have been done in a bipartisan way, but President Obama decides that he's going to force this issue, and we're going to have what we have. And just mark my word. I mean, just let history be speak as to what happens to these things and how these costs get inflate. Thank you.
I don't agree as written the Affordable Care Act. I think that we missed the boat on the biggest issue, which is tort reform. And that's the reason, because all the lawyers are running it. The lawyers decided that they wanted to keep the money flowing when it comes to medical malpractice and other insurance issues. An example of that is, a big example of that, is you go to the doctors and you have an issue, an ailment of some type. You know what it is, you're like 99.9% sure. Your physician's 99.9% sure what it is, based on your symptoms and his examination. But he's going to send you out for other tests. Could be just blood workup, whatever it is, just to make sure that you don't have anything else, just to cover his or her butt, to make sure that in the end, if it does come up that you have something else and it wasn't tested for, you won't come back and say that it was misdiagnosed or improperly treated, etc., etc. So all the doctors are covering themselves on that. There's good parts of it, pre-existing conditions. We need that. We need reform. We just don't need it the way it's written in 2,000 pages that a lot of people don't understand. I also concur with Pat when he says, what's going to happen, I believe it's 2021, when the federal government isn't paying the Medicaid portion anymore, and we have 30,000 to 40,000 people additionally on our Medicaid rolls. How are we going to pay for that? There's only one way to pay for it. Come down to the middle class. And there's going to have to be more taxes out there in order to pay for them, because the money has to come from somewhere. So I think we missed the boat with tort reform. It needs to be addressed. It was never addressed. I think it's a big part of what's driving the medical costs up in this country. So that's my opinion.
For our candidates.
Hi, Everett Lamb. I've been a resident here for about 10 years. I am a practicing primary care physician in our community for the last 10 years and a pediatrician. To quote one of our representatives who was going to, he promised to focus like a laser on economic issues when he was elected, but yet there was a large or seemingly large social agenda before the legislature in the past year. And I think maybe I can kind of poll everybody without picking on one particular person, but I fear that in the last or the current assembly, women's rights have come under tremendous assault, which has affected not only the women, our neighbors, our family members in our own community, but has affected the healthcare community as well, and is placing, I think, an undue burden on us. And some of the bills in particular that I'm referring to, when we talk about economics, there was a bill before, which was House Bill 228, that was before the legislature, and there was a vote limiting women's access to health care by prohibiting states from contracting in any way with any hospital or health care provider that provides general abortion services. This bill jeopardized $700 million in federal Medicaid matching funds because we were taking a stance and allowing the government to dictate to women in our community how they could take care of their bodies. That $700 million would almost make up the full deficit that Representative Abrami said was left over in the budget. Other bills, defunding Planned Parenthood in New England and jeopardizing health screening to get access for more than 15,000 residents of our state. That's low-cost health care that most other places in the community, not even at Exeter Health Care and not even at Portsmouth Hospital, can provide to people who can't otherwise afford it. Other things that kind of dovetail into that. There were some votes that purposely obstructed a woman from receiving a legal abortion and forcing doctors to provide false and inaccurate information to patients, such as stating that abortions cause breast cancer. Mr. Abrami, you're a healthcare expert. I wonder who weighed in on that and told us that that was the way that our representatives were going to vote and tell us as doctors that we needed to inform our patients. So rather than going through all of the bills, I'd really like to kind of get a sense from the panel and our candidates as to where they would fall on those social issues, because I think those have huge medical implications and huge financial impacts on our community.
Thank you. Why don't we start with Bob and go down to Tim if we could?
I think we might have missed a couple, so we'll add those to the list. One was parental notification, which basically those that voted against it were saying that 13-year-old should be able to go out and get an abortion, I believe, on their own.
If I could continue, not a debate, just a point of clarification on that though. As a pediatrician in the community, we have 13 and 14-year-olds coming into the office who've been raped by their own parents, by their own father.
No,
And these folks need notification from that person who injured them.
No, I understand that, but we should let's talk about all the issues, okay? Because we have also had one for partial birth abortion that there's a lot of strong feeling about. But you know, the whole discussion should probably start out with the fact that Roe versus Wade is the law of the land. Number one, period. As far as the different bills that came up that I'm familiar with, and again, I'm not an elected official, so I'm just going off of what my research has shown me. But I think I definitely would have a problem. I wouldn't have a problem voting for a bill that would allow for parental notification or not allowing partial birth abortions. And a couple of the other areas that you're speaking to has, again, come back to government funding. And government funding is government funding, and when you're borrowing 40 cents on a dollar to produce that funding, that's a problem. I mean, I'm waiting for someone to come from the other side and explain to me how we're going to eliminate that $17 trillion debt. Because no one really wants to talk about it, other than the fact that from the experience that we've had even in our state under the democratically controlled legislature prior to the current one, there was an effort to get this state further into debt by borrowing money to pay the bills. And we saw the largest increase in debt over the 4-year period that they were in control that we've ever had, which to me looks a lot like what we're seeing in Washington. And of course, I mean, the emotional issues are emotional issues, there's no doubt about it, whether it's abortion, whether it's taking care of, you know, my mother when she's, you know, in a nursing home, you know, dying. I agree 100%, but just to ignore and not try to, I guess, come to the table and try to figure whether there might be some common ground that we could get to. I don't see that as being fair either.
Okay, first I want to respond to, I guess New Hampshire is going to get rid of the federal deficit by not taking any education money from the federal government or for health and human services and whatnot, and those things all have to be met, or we just don't care about people and educating our children and the elderly. Just for example, I spoke to people from the Department of Health and Human Services. They had to have a $26 million grant that they applied for and received from CMS. But the Finance Committee right now is holding on to that because they're thinking that maybe they want to send it back to the federal government to get rid of the deficit. I want everybody to realize what's going on. We all pay federal taxes. We are part of the United States. We pay federal taxes and that money is going, all these other states will be saying, oh good, another one doesn't want any money, another one doesn't want any money. And then it's going to go all to a certain amount of states that have some sensibility about this. Regarding, first of all, partial birth abortions do not happen in clinics. That is they only handle first and second trimester abortions. I voted for, I don't remember the circumstances, but I am against parental notification, basically because I really think that most families, hopefully, if they will be talking to their children or their children would be able to come to them, but my concern is that I can't imagine a 13-year-old girl not being able to talk to anybody and having to have a child from someone that they were abused by, whether it's a family member or a neighbor or whoever. I can't even imagine a 13-year-old girl going through that experience. That was my concern with that. And I'm done, I guess. I think I said enough.
Pat?
Well, first off, I take umbrage that there's an assault on women going on. I have family, I have sisters, I have daughters, I don't see that. We take, by the way, we take plenty of federal money in our state. Today, I don't have the exact figures at my fingertips, I have it in my folder here, but we take plenty of federal money. But let's talk about some of the issues that came up. Partial birth abortion, clearly against it. If you heard the testimony we heard about partial birth abortion, you make your hair curl. Obviously, if the life of the mother is at risk, fine, there's a real medical need for it, but there's really no other reason for partial birth abortion to occur. And all that bill was to strengthen the federal, because there's a federal law that was passed by a Democratic Congress against partial birth abortion as well. Ours was, but some states were getting around that law, so we tightened up our law. Parental notification on abortion. I'm for parental notification, and I know my friend over here is at the eye of the storm when it comes to some of these issues, but the bill that we had before us had a provision that if there was that kind of a situation where the child was raped by a parent, that the courts could intervene and the courts be involved. You got to contact social services to be involved, to get the courts involved, and that in that situation, the child would not have to bring their parents in. But there was a provision for that particular situation. Can I finish and then we'll... Planned Parenthood funding. I'm all for Planned Parenthood, but with the bill that we had before us, simply did one thing. It said, we're not going to take government money and use it for abortions. So what the bill called for was a separation of the Planned Parenthood books, so that the federal money would go just to all the health services, women's services, except for abortions. That's the bill that I voted for. I also agree that abortion is settled law, and that we're nibbling around the edges here with some things that states still have some say in when it comes to this. And then one other thing that was mentioned was I think it had to do with cutting off funding or something for women's services, or I think he meant the whole thing about trying to force via Obamacare Catholic institutions from doing abortions or from providing birth control and all of that. To me, that was a constitutional issue. The Constitution does have some say here somewhere, and that to force a Catholic institution to do something that was separation of state, church and state, I couldn't abide by. So that's why my vote came on that, down on that one.
Thank you, Dr. Lamb, for the question. I didn't vote for a lot of the things you just mentioned, maybe because I'm the only moderate Republican up here, and I believe in looking at the bigger picture of society itself and what's needed. I believe in looking at what Planned Parenthood does, the other many, many things that it does that are very positive. Kind of like we were talking before, it's like the catch-22, the cat chasing his tail here with Medicaid costs. Who's going to pay for them? Well, here we have a private entity that was taking federal funding and state funding, yes, but they're still taking private funding and producing the pap smears, birth control, contraceptives, OBGYN exams for people that can't afford them, especially for our youth today that are still in high school, graduating college, or in college, who have had no health insurance. And a lot of people think, well, it's covered because the American Affordable Care Act says that they're covered till 26. No, not all people are. If your parents work for a government entity, it's not covered. If you work for Liberty Mutual, it's not covered. Any big corporation, it's not going to be covered because they all got waivers, so you don't have to cover them. So who's going to pay for that? A lot of these kids would go to Planned Parenthood. And then we have the other catch-22, the abortion issue. Well, if we have an entity that's willing to educate and provide contraceptives for these people, we wouldn't be having the abortions. So I look at the bigger picture, if you will, of what's going on in women's rights, and I'm a firm believer in who am I to get in between a physician and a woman as far as what needs to be done or what they feel needs to be done between the two of them. Because it's a hell of a decision to make. I'm not going to get in the middle of that, and I don't think the legislature should.
Well, 7 Drury Plains Road, I've been a Stratham resident for 25 years. And before I ask my question, I'd like to get a quick clarification from Mr. Abrami. Mr. Abrami, I got your flyer yesterday in the mailbox. I'm sure we all did. And a casual reading would lead one to believe that the Exeter newsletter has endorsed you. Is that correct?
They endorsed me in the, I looked the date on it, and there was endorsement in the Republican primary, yeah.
Right, okay, so they endorsed you in the primary, but for a casual reader, they did not endorse you for the general election.
No, not yet.
Right, so I'd like to ask a question that I believe has nothing to do with money, so we may all be relieved by that.
Can I just answer that? That's an accusation. I was very proud of the endorsement they gave me. I thought it was a great quote to put in the mailer. Simple as that. I wasn't trying to mislead anybody.
All right, thank you.
Okay?
So my question, Speaker O'Brien's Republican legislature, despite promises to focus like a laser on the economy, brought more than a dozen bills regarding gun liberalization to the floor. And Mr. Abrami and Mr. Copeland voted on those bills. Included in those bills were allowing guns in the State House chambers, allowing guns in college campuses and dorms, in athletic stadiums, public parks and beaches, allowing loaded rifles and shotguns in vehicles, allowing concealed weapons without a permit, eliminating various licensing requirements, supporting stand your ground legislation, including an override of the governor's veto. Now, it is my belief that most law enforcement organizations do not support these laws. Mr. Abrami, if you would start first, I believe that you voted for virtually all those bills. And Mr. Copeland, if you could go second, because I believe that you virtually voted against all of those bills.
Thank you.
Where does one begin? First off, I've never fired a gun, I've never held a gun, I've never shot a gun, but I do believe in the Second Amendment. So let's start with that. Let's start with the State House. For hundreds of years, the House and the Senate, you were allowed to carry a concealed weapon if you were a legislator. Okay? Democrats took control 6 years ago. On the House side, they did away with the rule. Okay? They did away with the rule so that representatives couldn't carry. But guess what? The Senate could still carry. The Senate still could carry a gun if they wanted to. Now, I don't carry a gun in the House. My friend over here does. But guess what? For those 4 years, if you've ever been to the Concord, to the State House, there are no metal detectors in any of the buildings. There's like 3 or 4 entrances into the main building, the Legislative Office building, no metal detectors. So here we are in a situation where any crazy person can come walking in to the gallery and start shooting. To be honest with you, I feel safer knowing that Tim Copeland has a gun to protect us, okay, from crazy people. There is, believe me, there was no concern. The 4th graders are still coming. You walk into the grocery store with your child, the person next to you shopping can have a concealed weapon. What's the difference, okay? It's one thing if we had metal detectors, but we didn't. And so it was just a charade that oh, look, we're not carrying guns in the State House. So that's that one. I did vote against the bill that would have done away with background checks. I don't know, I thought that was a silly bill. Let me tell you the way the House works. There are a lot of bills. Anybody can file a bill. And what differentiates New Hampshire from other states in the federal government is that every bill sees the light of day. The Speaker or Chairman of a committee cannot squash a bill. It has to be heard in committee, and it has to come out and be heard on the floor. So a lot of the bills that you hear about in the press never make it anywhere. But you never hear the retraction story, like, oh, the Republicans are getting rid of kindergarten. I got more calls from Republicans on that one. And I said, no, it's not going to happen. It's only one guy who filed a bill that was upset, okay, made the press. But guess what? It came out of committee unanimous against. It didn't even, it wasn't even debated on the floor. Because it was done away with, because that's just the way our house works. It has to be heard and it has to be given I can't remember some of the other ones. I know there were some bills that I voted against and some bills that I voted for. I tried to use my judgment on these as best I can. Again, never owned a gun. It isn't like but I think people have a right to own a gun. Oh, the one about the loaded gun on the rack. The way I heard the testimony was that it was not. See, I don't know much about guns. Maybe Tim can help me. That it was in the chamber, but it wasn't. It couldn't go off. Okay, and this was something that I think Hunter's requested or something that is the reason why that bill passed. But I'll leave it at that.
I'm a former detective commander in the New York City Police Department. I'm well trained in how to use a gun. I've carried a gun my entire life. That's why I carry a gun. That's the only reason I carry a gun. If I just go backwards, and maybe it'll help Pat understand what he's talking about with this Hunter law. Long guns, rifles, shotguns, etc. For 76 years, we've had a law that says that you cannot carry a loaded firearm inside your vehicle. Why? Because they can go off without you pulling the trigger. Because they're mechanical in nature, and defects happen. And you can end up blowing away the person next to you at a traffic light if you hit a bump. Didn't make any sense. I voted against it. For 76 years, it's been a safety law. And that's why we had that law. Open carry, it's always been in existence in this state. Do people do it? No. Would you look at them sideways if they did? Absolutely, I would too. Open carry is when you carry a gun in the open. You don't need a pistol permit, you don't need anything, but everybody can see that you have a handgun exposed on you. Pistol permits, I believe in pistol permits. I have a pistol permit. But I believe in the checks and balances that go with that, and I would not vote, which I did not vote for, is to do away with the pistol permit system in the state. How can we do that? How can we have absolutely no checks and balances systems for people that are convicted of crimes, the people that are convicted of domestic violence? It doesn't make any sense. We need some type of checks and balances. And in this state, it's so minimal. It's unbelievable how easy it is to get a pistol permit. They have to give it to you within 30 days as soon as you file for it, unless they can find cause. And if they find cause, they have to produce the cause and show cause. And then you can still go to court on top of that if you wanted to. So it's very, very easy in this state to get a pistol permit. SB 88, stand your own ground. All the police chiefs were against it. I'm against it. How do you do away with menacing in this state? In other words, you produce a weapon against somebody who doesn't have a weapon. They're verbally accosting you or threatening you, and it could be just empty crap. But you know what? SB 88 says you can pull a gun on that person, and even potentially shoot them if you can articulate that you felt threatened enough that there could have been bodily harm. Ridiculous law. Absolutely ridiculous. I am a Second Amendment guy. I believe in the Second Amendment. But I believe in checks and balances. And if you do away with all the checks and balances, then we get all the nuts like we have right now, including some at the State House. It is what it is.
I'd like to respond to that also. I also believe in the Second Amendment. I don't have a gun. Wouldn't want one in my house. That doesn't mean that I don't believe in that right. However, I will talk about what happened when I was in the State House. There was actually a compromise that we didn't want to have metal detectors. We thought we could just put a sign up that said, no guns in the State House. And that's what was finally what was done. We didn't want to have the process and the cost and changing the whole atmosphere of the State House. But I have to tell you, when that bill went up and the Democrats killed it, when we were in leadership, it was quite frightening. The people up in the gallery screaming and yelling, having a gun strapped on their leg and telling us we're all going to get fired. And there's fourth graders in that gallery to the left and a whole bunch of people angry and yelling at us on the right. And if you would think for a second that we would have a shooting gallery of representatives that can carry a gun and possibly get the right ones, why even create that environment for that to even happen? It is a court of law. It really is. It's a state house. We make laws there. There are people that are going to be upset. There should not be allowed guns in the state house. It's that simple. And we thought at least just putting a sign saying that no guns in the state house was appropriate. And that is what created the big buzz.
I should at least say that I do believe in the Second Amendment, just as I believe in the Constitution. Listening to the discussion, though, obviously there's a lot of different thoughts on what that means and how far that takes you without having some controls on it. But it's another very emotional issue for sure. I don't have a gun either. I've had a gun in the past, but I don't have one now, and I wouldn't have one, to tell you the truth. But I would be going in with the idea that I would be supporting any Second Amendment type legislation that would be brought forward. It's just that it takes so much. It sounds like it takes so many different looks or so many different types of it that every piece has to be looked at and acted on. But that's why I come down at this point.
Thank you.
Hi, I'm Lester Cupp. I've been here for 28 years on Stratham Heights Road. I just went green in March, near the end of March, and I installed 19 solar panels on my house. I dreamed about it in '86 when I built the house. Finally did it. And it's pretty neat stuff that's come out of it. I get these monthly reports that tells me my footprint, et cetera, this and that. So just to kind of tell you what I've done as an individual, and I was very fortunate, I paid for it myself. Okay, not too many people are in that situation because they can be expensive. But to date, since the end of March, I have generated enough electricity to power 160 houses for one day. I think I've taken up Heights Road, probably, right? My carbon offset's 3.35 tons. I've saved 86 trees. Okay, just me as an individual. The question I have, again, is more on the climate change, where we're going, et cetera. And I kind of directed this to Pat, but anyone can talk about it. I noted that you voted to withdraw from the Regional Greenhouse Gas Initiative, which over the past 4 years paid $31 billion to the state of New Hampshire. I'd kind of like to get an explanation, your thoughts on that, and the rationale behind it. And I know it's a complicated initiative, the way it's written and formed and all that, et cetera, this and that. So even when I looked at hard time, where I zeroed in at it, where it kind of supports me in my solar places, the grants again. It allows grants, not residential, but say non-residential, et cetera, this and that. And when I talked to my installer, they mentioned to me that, yes, there's been solar hot water panels installed, and there's, I think, something up somewhere in New Hampshire where they're doing a school or something like that. And I'd like to understand your rationale, because my understanding, and since we withdraw, we're not getting anything from it, but we're still paying for it indirectly. Can you explain that as to why your rationale?
Okay, thank you for the question. What we're talking about is the RGGI program, Regional Greenhouse Initiative, which has been in place for quite a while, I guess. and we had a bill to back out of the RGGI. And I actually agree with that. Not that I'm for global warming, or not that I'm not for green energy. I think that's the way to go. But it's got to be a mixture of things. And we need a transition to get from where we are now on a fossil basis to a more sustainable. And the big issue that we need, both in solar and in wind, is two things: storage issues. How do we capture that and store that energy so that we can use it when we need it? And the other is transmission. How do you get your electricity? How do you get your solar? Unfortunately, where the sun shines in the country isn't necessarily where the people are, and you have to transmit that power. So, RGGI, I was against cap and trade because this is what it is. It's a cap and trade program, and it makes the brokers on Wall Street rich because they trade the chips, if you will, on Wall Street. And it's also a fund that sits out there when Democrats 3 or 4 years ago were trying to balance the budget. They grabbed, there's $3 million in the RGGI fund sitting there, and they grabbed it and brought it over into the general fund. So it's an easy target to be just siphon off that money and use it for other things. I think it helps some. Obviously, it's helped you.
No, I stand corrected. It basically, the fund initiative is not for the current funding that it goes for solar power installation today. Because I did get tax credits from the state of funds from the state of New Hampshire, and then when I file my tax credit returns, I'll get some. This doesn't really cover that. This covers basically all phases of energy savings, etc. If you want to put insulation in your house, you know, this and that, it covers that. There's one piece where it also provides grants, okay, to fund solar panel installation, etc. But it's the grant side that by withdrawing ourselves from it, okay, we don't get the benefits from it, but we still kind of like pay into it indirectly, type thing. So it's like, I don't understand, it's like a no-brainer. It's like, again, giving money back.
Well,
but we still end up paying as we go along, because there's several states that are in it. I mean, Connecticut, Delaware, Massachusetts, Maryland, Maine, New York, Rhode Island, Vermont. We withdrew.
Well, I think we're still in it, because here's my biggest reason why I against it, is that basically what happens is it's an indirect tax on your electric bills, okay? This gets passed along on your electric bills, okay? But then the benefit only goes to a certain handful of people, all right? It doesn't go to everybody. It's those it is. So that's my biggest concern about it, and that's why I don't think it's the way to go.
Well, yeah, but it costs us 43 cents a month, okay, for this initiative type of thing. Okay, but we're giving up millions of dollars, okay, because we withdrew from it.
I think people are very passionate tonight. They want to be in a debate. So, did you want other candidates to anscer the RGGI question?
They can. Where they support. I mean, where the headset is on green energy.
I was giving the bottom answer. I said I don't believe RGGI, and I didn't believe going into the. I was surprised that there was. I didn't even know about the RGGI program until I became a legislator. I was against cap and trade from the beginning. And when I found out that we had a cap and trade, regional cap and trade program, obviously I was against it for the reasons that I stated. I just don't think it's the way to go.
Any other candidates wish to weigh in?
I voted for it. I don't remember what year. I think it was 2006.
Tim, how did you vote?
I'm not a fan of RGGI the way some of it's written. And I try to look at the bigger picture. I agree with what you're saying. I think it's great that people would volunteer to get green. And I have no issue with that, because you're going to save money in the long run. I think we're a long ways off technology-wise of making it cost-effective. I own a hybrid. The only way that hybrid is going to be cost-effective is if I keep the car somewhere between 17 and 20 years with the current gas prices. If it goes up past $5 a gallon, everything comes down in the years. So we're a long way off technology-wise. We're getting there, but we're still a long way off. I have issues with the bigger picture. Ethanol, for example. 10% of it goes into our gas right now, federally mandated. It takes 4 gallons of US gas to make 1 gallon of ethanol. Why? To run the machinery, and ethanol is so corrosive, it can't be piped, it has to be trucked everywhere. Does that make any sense? We're using 4 gallons of gas to gain 1 gallon of ethanol so we can mix it and do a 90-10 ratio? It doesn't. So I try to look at the bigger picture. I agree with solar, I agree with wind, and again, we need to be able to harness it. We need to get the panels smaller, the energy effectiveness, the result of what we're taking in bigger and greater. Some of these machines, and I forget the name of it off the top of my head, that takes your solar electricity and transfers it over. That device itself is extremely expensive. It only has about a 10-year shelf. I'm talking on the commercial level, not on a residential level. Because that's where the money, the big money savings is on those. Because you're talking about a $10,000 unit, which only has about a 10-year shelf. I'm sorry, it's $20,000 with a 10-year shelf life on it.
Yeah, that's old technology. I have microinverters on each panel. They're a couple $100 each. They tell me what each panel is doing. It's all the new technology.
That's great, especially if you could do it on a commercial level, because that's where the big savings are for corporations. A lot of reasons why, just a spin-off of that, of people are trying to say, well, how come businesses don't want to come to New England? All right. Some people blame it on right to work. All right. Horse crap. It has to do with what it costs per square footage here. It costs a lot more money here than it does down south because we have to winterize everything. It costs a lot more money in electricity and oil because you got to heat it. So there's a lot of other big variables that come into play of people coming here for business and utilizing the resources that we have.
I'm trying to remember that. I remember thinking that at the time when I voted for it, that it seems to me that it would help in energy efficient projects in the state and help, the economy with some businesses that would want to go that way.
Bob, did you have a take on the Reggie?
My limited understanding of it is, going back to what Pat was saying, though, is that one of the way that it's funded is out of our electric bills that the rest of us are paying. If there's money coming out of those electric bills, it'd go into that fund. That's been the biggest negative that I've heard from anybody I've talked to about it, as far as why should we, other than green is great, why should we have to pay for that? I have to admit that's my limited knowledge.
Thank you. Great questions, and I think that's great that you're solarized your home, and I think it's quite exciting. Would love to come over from the newsletter and take a look.
Sure, I'll give you a tour. It's really neat stuff, not to pay. I pay a $10 service charge a month.
Can I ask you a question?
Yeah.
How do you deal with it? How do you store it?
Well, it's something else you guys can look into, because the crazy thing was, the way, not part of this, thing, but the current funding where you get credits back, etc. I was told that I could only install 6,000 kilowatts a year of capacity, okay? If I was to go more, I would get no credit, okay? So I could go from whatever to 6,000. I said, that's kind of crazy. So what happens is, any excess power that I generate goes to the utility company, okay? So it's right now put me in a position that I need to balance myself between not giving all this energy back to the utility company because they don't want to pay me for it, okay? So it's like, who the hell wrote that bill? We should all be able to, okay, to put as much as we want on our houses to generate all of what we can to give back to the utility company. But It's some type of cocky mind, you know,
No, I agree with you on that.
okay? I couldn't believe what they told me. No, you can't put 6-foot paper. Stupid.
Thank you.
Okay.
Any other questions for our candidates? You've waited very patiently, thank you.
Thank you. Dave Sandman, I live at 8 Oak Lane. I do not have solar panels, unfortunately. So my question doesn't have to do with solar panels. My question has to do with the general court this last session reduced the cigarette tax, which affected our state revenues somewhat. And also, we had to reduce our aid to UNH and state colleges because we had less revenue. So the question is for the two representatives who are currently in the general court, and in terms of how they voted and why they voted the way they did, and to the two candidates for the general court as to your opinion relative to the cigarette tax and its fallout in higher education. Thank you.
Thank you. Well, we'll start with Tim and then Pat, and we'll come down this way.
Dave, I voted for the cigarette, to do away with the cigarette tax, and I'm sorry I did. Because I didn't understand it that well when it came up, and I understood it better after it was in. I felt like the wool was pulled over me, my eyes, by the speaker, in that we got this 10-cent reduction, and within weeks of legislation nationally, all cigarettes went up 10 cents. Go figure. So I didn't like that. I felt that it was kind of like a shell game that went on, and the speaker won. Yes, we've lost revenue on it, but one of the things why I voted for it was, besides speaking to Pat, and he helped educate me on it, and that was a good thing, because it was a lot worse before speaking to Pat, as far as understanding it. But there's a fail-safe built into it, and that's one of the reasons why I voted for it. That if it didn't work, if it did fail, if we were losing all this revenue, that it would come back. That's what I liked about it. That if we made a mistake, the mistake can be corrected. But I am sorry I voted for it.
I'm sorry, before we move on to Pat, he also had asked about the college system. I just want to make sure everybody answers the question.
Sure. It's very short-changed. So much so that, unfortunately, our kids are going to be paying for it. Nationally, college tuitions go up 6 to 8%. Why, nobody can really explain. I mean, we could all be in the negative as far as inflation and everything else, but the colleges are going up no matter what. So we've compounded that now with additional costs for the kids coming in. Right now, for the UNH, for example, it's averaging, if you're staying on campus and you're an in-state tuition, about $26,000 for books and everything else. That's expensive for an in-state college. I didn't vote to take that money out of that system. It came under the budget, and the budget had a lot of things on it, and I voted the budget against the budget for many, many different reasons, and the college system was just one of them. There were so many more. Health and Human Services, I mean, Trinka touched on the Children in Need of Supervision Program, of Services Program. That's huge. This is an intervention system designed by the family courts to step in, and for our officers dealing with truancy. There's no mechanism now for truancy. That's been removed altogether. So this system was in place to intervene on behalf of the juvenile to prevent that person from becoming an adult criminal offender at a cost of $35,000 or $40,000 a year for incarceration. I did the math. It didn't make any sense to do away with the program. Do away with the domestic violence program for women. What? Guess what the #2 crime is in our state? Domestic violence versus DWI. I mean, come on. How do you do away with a program like that? It didn't make any sense. And then cutting the tuition of $100 million for not only the state system, but the community college system as well, because they're being affected as well. Didn't make any sense. We need to restore, if anything, 50% of those funds, if not all those funds. Once we look at the revenue projections and see where we are, and right now we're ahead. So we have to look at that and re-examine not only the education system, but the health and human services side of the people with severe disabilities that have been severely hampered as well.
Well, I'm on Ways and Means Committee. We took first shot at this. And our job is to do accurate revenue projections, in which our revenue projections were pretty good overall, right on the money, 0.2% off. One of the things when the cigarette tax bill came up, we took a look at where the cigarette tax had gone up from 0.98 cents a pack to $1.78 a pack in about 4 years. And one thing that was apparent was that we were starting to lose border sales. And my gosh, we are a border sales state. We sell our alcohol, we sell our lottery tickets, we sell our cigarettes to Massachusetts people, Maine, and Vermont. And it was clear from testimony and even the Democrats in the committee and Ways and Means agreed that we were losing border sales. There was no question. I got right here, and you can see the hard number right here. This is the revenue report from year ending fiscal 2011. The cigarette tax revenue had dropped $17.1 million on the Democrats now from 2010 fiscal to 2011. I'm right here, okay? So we said to ourselves, well, maybe we've reached the tipping point. And this was purely a business decision we made, okay, that, maybe to draw, how are we going to get back these border sales, okay? And we said, well, we want to reduce the cigarette tax to 10 cents. A lot of us said that's probably not going to be enough, but we reduced it to 10 cents. Not to reduce revenue, but to increase revenue. It's a basic business principle. At the same time, we dealt with a bill that the Democrats had put in place, the gambling tax. People don't even know there was a gambling tax for a couple of years. Gambling tax. We repealed the gambling tax in this session because the lottery commissioners, the executive director, the gaming commission came to us, begged us, please repeal this tax. It's killing our lottery revenues, it's killing our gaming revenues. Same principle at play. I don't see anything in the press. I don't see any outcries about, wow, geez, you like gambling, you got rid of the gambling tax, okay? So it was purely a business decision to do this. We saw falling revenues, and we made a gamble. We even had the governor's budget director come to us just this year and says, you guys really took too long to. I mean, October revenues are up 10 million above, 2 million above projections. These things go up and down. And as Tim pointed out, there is a trigger that if this revenue doesn't come back, that the tax would go back up. We could talk about health issues, we could talk all about that. I don't know why anybody smokes. I really don't. Okay? I told the people from the Cancer Society, you put a bill in the national level to ban cigarettes, and I'll support that bill. Nothing to do with that. When it comes to Ways and Means, this is simply revenue. We put it as a revenue bill. Okay, it was how do we get revenues back? Because cigarette tax is the hypocrisy bill of all. It's a hypocrisy tax. The day that people stop smoking, well, people are going to go, whoa, we're missing that tax revenue. Okay, it's one of those taxes that's just unbelievable. But guess what? It's our fourth largest revenue stream. Is a cigarette tax. It's okay. I got the done sign. I didn't really touch on the other issues, but I'll.
Emily, I have a follow-up question.
Do we want to let our other candidates answer?
Before we go. I understood that our cigarette tax, or our cost of cigarettes in New Hampshire was already less than Massachusetts, Maine, Vermont, New York, Rhode Island, and Connecticut before the reduction in the tax.
Right, but can I,
So the revenue may be going down because people are smoking less, not because of a 10% tax.
No. Well, I'll tell you why. We concluded this. We had testimony from convenience stores all along the borders begging us to please reduce the tax. Mom and pop convenience stores coming to us, guy in Portsmouth, saying you had to lay off 2 people because since the tax went up $1, the cigarette tax in Maine, the cigarette pack of cigarettes in Maine and New Hampshire are almost the same, plus with the gas prices going up, people were just not going to travel over to New Hampshire to buy cigarettes. So that's why we did what we did. And we heard it. Then I got calls at home from elderly people who smoked all their lives and are never going to give up smoking. And guess what? Cigarette tax is the most regressive tax there is. It's a regressive tax because it's the poor who usually smoke and they can't afford it, and we're increasing taxes on the poor. When people call me, when the elderly called me, and I had a couple of calls like that, I said, well, why didn't you just give up? Why don't you quit? And they scoff at me like, I'm going to die of something, I'll die of this. I go, okay. But it's nothing to do about, it was nothing to do about, again, health. This was not a health policy issue. This was a revenue issue.
Thank you, Pat.
I wasn't there.
I can say in New York, I was just home visiting my family, and I'm at a card store getting a card, and I see a sign there that says Marlboro is $11 back.
Yeah,
So I think
New York City,
$11
New York City has the highest cigarette tax, highest cigarette per pack. I've noticed it since I've been a legislator. I've never noticed it before. I never bought a pack of cigarettes in my life. New York is $11, $12 a pack. And it's all, basically, city has put a tax on top of the state tax, which are high. But you know what's going on in New York City? Is that the truckloads of illegal cigarettes are coming. It's become the new bootleg thing. It's one of these things where you tax something enough, and the bootleggers are going to come with the tractor trailers from the Carolinas. And that's exactly what's going on, and it's well documented that it's a whole, given the mafia and all the other legal organizations, another outlet for making money, and without stamps on the packages.
Thank you for your question. Answered, and Herb's raising his hand. Did anyone else also want to ask a question besides Herb? David? So we'll take these two final questions and then we'll move on. Who wants to go first?
Go ahead, Dave.
David Cantor, I live on Bunker Hill Avenue here in Stratham. As the economy gets better, we expect our revenues to go up in the state. And I've heard a lot, or read a lot in the paper about how we need to refund this or refund that, or increase funding for different things for cut. And I was wondering, as Tim, you brought up about the town trying to keep taxes down as best we can. And as we approach budget season, I know that we're facing a 25% roughly increase in the state retirement costs. A lot of it's due to poor management in the past, and there's nothing we can do about that to pay the piper. But a lot of it's due to the downshifting in costs. The state has reneged on their promise to pay a certain percentage of the retirement costs for town employees. They made that promise to entice us into coming into their system. And I'm wondering how you rank that as a priority in restoring funding with some of the other things I've read about, such as we've touched on here, education and so forth and so on.
Is that for all the candidates?
Yes, please.
Okay. Can we start with Bob and go down the table?
Yeah, this has been a question that I think has come up in every forum that we've had as it relates to the pension program, and then ultimately backing it down to the local level and the impact on the schools. Both Republicans and Democrats have had a play in this. The downshift has taken place, starting with the Democrats when it went from 35 to 25, and now the last legislative session took it out totally. The difference is that the last one did make changes to the system that will have a positive, at least have a positive impact on the unfunded liability that the system currently has, which Pat mentioned earlier is in the $4 to $5 billion mark. The other thing that they're currently looking at, it's in study right now, is this whole question about going from a defined benefit type program to a defined contribution plan. The thinking being that because of the way that the defined contribution works, that it'll both help from a standpoint of cost and also eliminate with a defined contribution plan you wouldn't have unfunded liability, because what's there is there, and that's what's available for the retirees. But from what I've heard, the big issue is the transitioning from the defined contribution plan, or from the defined benefit plan into the defined contribution plan, and how that will, how the defined benefit plan will continue on, with the idea being that the younger, new people coming to work into the different types of jobs would be moved into the defined contribution plan, and they'd have there'd be some level where the folks that were still in the contribution, the benefit plan level would stay within that. So I know that's an issue. I also know that, again, it is something that they're currently looking at, and I don't think we've seen or have the answer at this point in time, but we do know that through some of the other reforms that were done by the last legislature, that we've seen a decrease in the unfunded liability by about $430 million. So we're going in the right way. At the same time, I know that a couple of changes were made that raised the retirement ages of those folks, that whether it's teachers or police or firemen that are in there, that those retirement ages were raised in order to get to that. So I think we're probably going to see more reform. In the meantime, no doubt about it, the local communities are going to see the effect of that.
Ellen, can I focus my question a little bit
Yep.
better? I'm not asking for a discussion on the retirement system and its pros and its cons. What I'm asking is, when we start restoring money, is that first on your list? And community college is second on your list? Wait list third on your list? Or is wait list first on your list and community college second on your list? Reestablishing funding for towns, is that third on your list? I'm asking for a ranking of how you're going to restore money when the economy improves and we start getting more tax revenue.
Me personally, I wouldn't know how to answer that question. With all the demands for the funds, whether it's UNH, whether it's Stratham, elementary school, what it is, I think that when the funds are restored, I think it's going to have to be looked at as part of the overall revenue and matched up against what the costs are, just as this last legislation did. I don't see how that's going to change going forward. Even when the revenues start coming in, I think at least I think from a Republican standpoint, they'll follow the same process.
Trinka?
I actually don't know how to answer this question because it's a tough one. When I was up there, the best way I can just first of all, I don't have a lot of knowledge about that the retirement system to begin with. But what I will tell you is that I do recognize that anything that we do up there that we take away from that are mandates, whether it's TANF or anything else, I know that's going to have a direct impact on the community, on anything that we do. So basically, in my perspective, is that I really think that we're at the point in this state where funding has gotten to the point where there isn't any. It's at the bare minimums for everything. And I think the way we tax in this state, it's from property taxes, fees, taxes on cigarette tax, that sort of thing. I think we need to, we got a bad rap, the Democrats. They said we increased 100 fees. Reality is that a lot of those, 30% of them, 35% of them were Republican bills. I mean, you look at things and you look at fees and that's the way we do things in this state. We don't have an income or a sales tax. So I will look at everything that's going to help increase revenues into the state so that in the end, it doesn't come back to the property tax. That hurts everybody. And when we don't provide enough funding for retirement system and that sort of thing. I'll give you a perfect example. There was one bill when I was up there, it was, I might not get this 100% right, but there was a saltwater fishing license bill that came into play, the fishing game. And the federal government said that they wanted to watch how many fishing license will be distributed in our oceans, and who is, how much fish, what types of fish will be in. They needed to do all this get all this information. And they said to the state that if you don't implement this saltwater fishing license, we're going to. It's going to be mandatory. It's going to be $30. So we're giving you the ability to do it first. And I don't remember the amount, to be honest with you. I think it was about $15. But that makes sense. If the federal government is going to say, well, if you don't do it, we're going to charge $30 and, for this saltwater fishing license, well, so then we implemented it, and it cost $15. I mean, and the state saw the money. I think a lot of times when we do all this rhetoric about fees and taxes and, we increase them and they decrease them, there's a point, we're at a critical level here where the community, our property taxes are going to go sky high. We are not doing anything for our elderly. We're decreasing funding for our education, for our kids. We're going to move out of the state and go elsewhere to other universities. I think what I'm going to do is I'm going to look at every opportunity that seems like a fair and reasonable, and not shy away from, yeah, I said yes to that fee, or yes, I said yes to that one. I'm done. But anyway.
Okay, Dave, yes, it was a tough budget year, no question. We inherited a $800 million budget gap, and we didn't have time to really describe everything there, that it was a true gap. And again, when we did revenue estimates, it was clear that the economy was not coming back as fast as anybody wanted to see it come back. The economy comes back equals greater revenues. But when we had a chance this year, we did, by the way, Trinka, add $1.5 million back during the course of the year by a floor motion by the Republicans, actually, to add $1.5 million back in developmentally disabled wait list money. So that was added back in. So to answer Dave's question directly, I guess I had listed them in the Exeter newsletter article in terms of, yes, we want to refund some things. University system was on top of my list. Chin's program was second on my list, and then I had some funding back to the hospitals that we took away from the med program, and then the fourth thing was, I called it block grants for cities and towns to handle it in that way, to try to fund things that were promised, and they were promised. I understand that going way back. It originally started at 40%. Went down to 35, and then it went down to 25, and then it got zeroed out. But the one thing that we did do when we went to zero was that we did the pension reform at the same time. So there was some offset. Did it balance out 100%? No. But it wasn't just cut to 25% without action. We took action. We did the pension reform that was needed to offset. Because, I mean, if I can give you the number. Let's just take the employee contribution was supposed to go, the town's contribution for the employee, not the teachers or the fire and policemen, let's use one example, was supposed to go to 11.09% in 2012 and 13, but it went to 8.8%. So that got reduced, okay, but taking away the 25% didn't quite cover that reduction. So yes, there was some hit to the town and into the school districts as well.
And you're ranking it fourth to replace that, is that what you're saying?
Yeah.
The 25% didn't even come close to doing what it's supposed to do. But to answer your question directly, Dave, I would list it second, education first. Restoring the funds in the education system. Again, the cat chasing its tail with what's going on and the cuts that we did make, and how it's going to affect the towns. The average pension for a municipal or state employee is about $12,000. What we did in the last legislature was, there was a blanket amount of money, I believe it was $38 million, which covered health care for active and retirees. They reduced that to $27 million. So the state administrative services, who are they going to go after? They're going to go after the retirees, not the active people. So those people that are on those fixed incomes of $12,000 now are incurring all these big upfront costs. An example would be a copay that you wouldn't usually pay for an MRI, which is about almost $1,500. Well, now you're paying almost 2/3 of that out of pocket for that MRI, if you're a retiree. So these people eventually will be coming into the towns for financial assistance if they have a catastrophic medical event of some type, because that's going to take primary over their monthly costs. So they'll come to us. It's important that we restore, that the state restores the 35%, because we're going to be paying a lot more. Not only are we going to be paying it more on the town side, we're going to be paying it more on the school side, because that's where most of the revenue and the taxes that we're paying are going to come from. And it's short, big time, millions and millions of dollars just in SAU 16 alone. So yeah, it's going to be reflected in increased property taxes. I wanted to just touch on something that Bob brought up, just because he brought it up and it's out there, about the pension system and about a 401k system. It's been reviewed. We're not reinventing the wheel here. Other states have looked at this, including New Hampshire, and a report has already come back that the 401k system isn't going to work. It's not going to work because down the road, we have to maintain our pension system at a certain amount of dollars. That's federal law. The 401k system isn't going to work because the new people coming in aren't paying for the present people that are in the system. Eventually, with longevity, those people aren't going to have the money. So it's not going to work. It's actually going to cost a lot more money under a 401k system than the present system. So that's already out there. There is a report on it. It just came out last week, and it is out there. So yes, we did other reforms. We increased the age. For example, in Group 2 from 45 to 50 for police officers and firemen. I really don't think you want to increase it any more than that. I mean, do you really want some 55 or 60-year-old firemen coming to try to carry you out of a building? You're both going to be a liability, believe me. And what they didn't look at, and I brought up on the House floor, was also, we have in our system for accident disability 66 and 2/3. So if you get out on an accident disability or work-related injury, those are going to increase, according to the New Hampshire retirement system, 3-fold by increasing the age any more than 50. Because there's going to be more injuries happening to people. Look, it's natural. We all reach a certain age, and things happen to us, and we can't heal as quickly, and we can't recover as quickly. So that's got to be increased, dramatically increased. I think sometimes we look at things short-sighted, not long enough, looking at the bigger picture, way down the horizon of what it's going to cost to implement or what it's going to cost to cut. We're short-sighted looking at the quick cuts first and not seeing what it's going to end up costing us way down the road, which is usually big dividends of what it's going to cost. But anyway, that's my 2 cents.
Thank you. Herb, did you have your question?
Herb Moyer, Exeter. A couple of quick comments and then a question for each candidate. And I'd like to focus back on energy. I just had my hybrid Prius retrofitted so that I can run 3,000 watts of house activities from my car. So it storms. It's a great fit. But I'd like to ask a question as an official of a local community organization. I'm the president of the Seacoast Anti-Pollution League, otherwise affectionately known as SAPL. We have been involved in helping protect the environment of the New Hampshire Seacoast since 1969. We are opposing the utilities' effort to extend the operating license of the Seabrook nuclear plant. They want to extend it from 2030 to 2050. It's already corroded. The cement is already corroded 22%. That's right from the Nuclear Regulatory Commission. So a study by the Department of Energy in Maine recently, and a study by the National Research Energy Labs, I think it's NREL, but the federal government, says that just off the coast of Maine alone, there is enough energy to replace 4 Seabrooks by the year 2030. So we are involved in a lawsuit against the NRC because they won't let us participate in the licensing hearings, which is unbelievable. But nevertheless, I want to know, with what happened at Fukushima and what people know about radiation, you can't smell it, taste it, feel it, but it's hazardous. And the utility and the Seabrook nuclear plant just failed a test in April. They failed to notify the county of a artificial release of radiation. They should have notified the county so that they could notify the communities and activate their emergency operations centers. They did not. I have no confidence personally from my experience working with utility officials who downplay the significance of anything that happens, that we would be notified properly in an emergency. So we have asked, and we've met with the governor, we've met with the emergency operation people in New Hampshire, asking for a commitment by the state to fund off-site real-time radiological monitoring, so every community in this area would know exactly when stuff happened. We wouldn't be waiting for the utility to tell us, oops, the wind is blowing westerly, there's a lot of radiation, there's iodine, cesium, strontium, you better get out of the area. I think it behooves us to help provide the protection that the public would want so that we have real-time, independent, off-site radiological monitoring. Question to you all is, if you get elected to the legislature, would you support an effort to fund and have independent, off-site radiological monitoring for in case of a nuclear accident at Seabrook?
Thank you. Can we start with Tim?
Sure, absolutely. Well, I'm the Emergency Management Director, Deputy Director here in Stratham. I'm very aware of the Seabrook plant. I'm very aware of the procedures that are in place in the event that there is an event of some type. But to answer your question directly, no, I would not support it. I believe that it would be way too costly to set up what you want to do, especially in a residential setting. Way too expensive. I believe in nuclear energy. I believe it's cost effective, more than cost effective. And I believe that the plants we're building are far better than Japan, and even the scientists from the United States who had input in some of the architecture, if you will, of what happened in Japan will tell you that their stuff is inferior compared to what we're doing today. Even the Seabrook plant is far better than some of the other plants we have, double containment walls. A lot of them don't have double containment walls. Future ones have it, but a lot of them don't. They're single containment. That means there's two walls, one interior, one exterior, so that even if a plane went through it, it wouldn't cause an issue with the plant itself. So I think the cost would be way too expensive, and it wouldn't be proper, because we're telling the nuclear plant that they have to bear the cost of the small communities within the 10-mile radius of the plant for radiation, but nobody else. I don't see it. I think the system we have now is very good. I think anything can be tweaked and could be better, but I think that we have a good plan in place right now when things happen. I understand your frustration with what if they don't tell us what's going on, and I agree with you that maybe sometimes if they have an oops, maybe, and it's a small oops, they all decide that they're not going to notify anybody else. That's a big problem. But I'm not sure how to address that. I know that what you're asking for is not the answer to address it, in my opinion. If someone has their own monitor and they can see that there's an increase in radiation, that they should just leave on their own.
Well, I'm not talking about residential monitoring. I'm talking about every community in the seacoast or within the 10-mile emergency planning zone. Every emergency operations center having their own independent, off-site radiological monitoring.
We have that.
And we don't have that.
We have that. I can show it to you.
Okay. You mentioned, did you think that I was referring to every homeowner
Yes.
having their own?
Yes.
So that's why you said it would be so costly.
Right.
Because the units, which originally 8-10 years ago, because Massachusetts did implement that, they were like $12,000, $14,000 a piece. They're now like $4,000 and $5,000 a piece to set up that whole system. Okay.
Well, when I say so we're clear about it, that we have it. We have, like for Stratham, we have 4 Geiger counters in Stratham. So we could at any time go out there and just see what the radiation level is.
No, my point is that you're not monitoring that all the time. You don't have data coming in to find out what's in the air, what's in the water.
No, we don't.
You do not have that. That's what I'm referring to. Real-time radiological monitoring.
Yeah.
Yeah, I'm open to looking at it. Obviously, it's a cost-benefit issue. I have no idea what these cost, so, you know, I would take it. As far as Seabrook folks, I went there a couple of months ago when they first discovered the cracks in the foundations, and they were trying to get ahead of the curve. They invited the legislators, I turned up, and as well as other local officials. I was the only rep that showed up. And I thought they were trying to be honest and let everybody know what the issues were and how they were going to try to rectify the issues when it came to that. This radiation leak, I'm not familiar with that at all. I don't know what happened there. But I'm for nuclear power. It's got to be monitored closely, and I agree with you on that. It's clean. It's a clean source of energy, and I'm all for clean sources. You know, the other ones that we should talk about is tidal and wave power. I think it's a good idea. Then you get other issues related to that. I'm digressing. I'll leave it at that. That I think I'd be open to looking at it as long as the costs weren't off the wall high. You know, and if we think there were real benefits, if it gives people the comfort that there isn't a leak, then maybe it's worth looking at.
You mentioned leaks. I just want to let people know that 67 nuclear plants, including Seabrook, including Vermont Yankee, have been releasing radioactive tritium for years, and they have not solved that problem, found where the leaks are coming from.
I don't know much about this. I don't know anything about this. The reality is that I wish we did not have nuclear power plants. It bothers me that the waste, we can't even figure out where to put it. We have to bury it in, you know, I wish we just would go forward with doing whatever we can to not be able to rely on oil, so that we don't have to rely on countries that, and that we did something about that. But I do have, Herb, I don't know anything about the subject. Are you saying that they do not do continuous monitoring now at the nuclear power plant?
They supposedly do real-time monitoring, but we do not get the data. It's all in-house. The emergency operations centers don't get regular reports, as far as I know.
And there is a reason? Did someone ever try and say, why aren't we?
We've tried.
The first thing is, why aren't they giving you the ability to know what the release is every day? I mean, that should be public knowledge, in my opinion.
I would agree with you.
Well, that would be my first thought, to have somebody else out there doing it, if they already do it, and they need to be able to give it, because that just seems like it'd be possibly a very huge expense. Yes. The first thing, it seems that should be public knowledge. On a daily basis, what are the reports of what's being emitted?
Great.
Thank you, Trinka. Bob?
I do support nuclear power, but as far as monitoring goes, I think the last point that was just brought up is probably a very good question. You're saying that they say they can monitor it, but they won't make it available.
On site only.
Right, they won't. The only problem with that is that they don't make it available.
Well, that's one problem.
Well, so again, I would agree with Trinka that I think the first place I would start is to find out why the information can't be shared. To be honest with you, and then beyond that, I think any legislator is going to be willing, or should be willing, if they have something come to from their constituents that they're asking to consider, that they should give due consideration to it.
Thank you. Thank you. Well, that concludes our questions. I'm going to ask the candidates to make a closing statement. I believe we started with you, Bob, on the opening statements. So let's start with Tim at the other end of the table and come this way.
Thank you. Well,
Excuse me 1 second. How many minutes do we have each?
They have each 5 minutes if they want.
For the closing. Okay.
Okay, good. I'm 56 years old. I've been a Republican for 38 years. But my philosophy is a little different than some of my colleagues. I believe that we're all individuals. I believe that we all have political philosophies, and that should be respected. I don't care if you're far right, far left, whatever you want. I mean, when I hear things like the Democrats are the enemy, which I heard a lot in the last 2 years, I think that's wrong. I think we're a two-party system, and we're all Americans. You may have your philosophy of how you want things done, or the way you want them, and who's going to pay for them, but so do the Republicans. And not every Republican believes in everything on every platform. People make platforms. Individual people get together at these conventions and make the platform. It's not all of you that are making these platforms. So they present to you a platform, and then they expect you to believe or follow it all. I don't agree with that. I don't agree with everything on the Republican platform. If you ask a lot of Republicans, do they believe on everything on the Republican platform? You'd probably be surprised by the answer, because the answer would be no, they don't believe in everything. Democrats the same way. So I think we need to get together a little better and to be more understanding in our civil side and respecting each other's opinions, to respectfully agree to disagree on a subject, instead of somebody looking at you like you're all screwed up, like you got two heads, because you're not seeing it the way I see it. Therefore, you're wrong, I'm right. That's what's going on across this nation. And it's a problem. It's divisive. Nobody's getting anywhere. And we see it all the time in our national government as well as our state government. I've been a moderate person my entire life. When I was down in New York, people called me a conservative. Up here, they're calling me a liberal. I mean, it's wherever you are, it's really screwy. I play well in the sandbox with others because I have to and I've learned to. Being in law enforcement in New York City, I had to work with everybody. And I'm talking about the extreme left, the extreme right. I've had to work protests. I enjoyed them. I enjoy people. I enjoy getting and talking to whoever it is out there and learning your perspective. Because you know what? You might have a better perspective. Or you might be that one piece in the puzzle that fits together for me. So I understand whatever concept it is that I don't understand right then and there. I've been to many UN demonstrations. I love them. I love talking to people. I always take a lot away from those, from people themselves, and a better understanding of what the human psyche is. I think we need to work together more. I think that this state is really a moderate state. I don't know where people are taking it to. But overall, if you look at the average of where we are and who we are as a political society, Democrat or Republican, we're mostly moderates here. I don't believe in the radical ideology of the last 2 years of the House, and I hope it changes. And I want to go back there, believe it or not. Maybe I'm just a glutton for punishment, I don't know, because I've been very upfront and out there working for all of you. And I take that very seriously, that I work for you. You guys are the ones that vote us in. I work for you. I don't work for a speaker. I don't work for leadership. I don't work for a political party. I work for all of you. And I think that's important. I think that there should be more of that people should represent the people, just as our Constitution says, not the parties themselves. I hope you'll put your faith and confidence in my abilities. I've done the best I could up there. I've stood my ground. I've enjoyed doing it. I'm proud of what I've done up there, and I'll do it all over again if you let me the next 2 years. And I won't let someone else tell me what to do and how to do it, because I work for all of you. Please let me have another 2 years. Thank you.
Everybody for the questions. We're good. Good questions. let's big picture. I grew up in New York, not too far from Tim, in Long Island. Lived in Massachusetts, I lived in Maine, I lived in New Jersey before I moved here 29 years ago. And I've consulted in 40 states, as I've mentioned before, so I have a pretty good perspective of what's going on around the country and what other states are like. And I can say without hesitation that New Hampshire is the greatest state in the Union. Okay? We're actually the envy of other states for what we got. New Hampshire is unique among states because of our fiscal discipline. Something that I think we lost between 2007 and 2010, and we've gotten back now to a more controlled spending and more rational budget process that we put in place. But New Hampshire ranks #1 or close to #1 in many things. Education of its citizens, health of its citizens, low crime rates, quality of life, always ranked #1 in quality of life. Our environmental quality is always high. Lowest number of people living below the poverty level, we're ranked #1 in that. And we just recently voted the freest state in the Union. And we've done this all with low tax rates. We've done this without an income tax or a sales tax. And if I had to say, why am I running? I want to keep it that way. I don't want to change the character of New Hampshire. Bringing in an income tax or a sales tax will change forever what we have here. New Hampshire is not broken. Sure, around the edges there are things that we can do, we need to do, but I would not consider an income or a sales tax. And there are many in the House, some Republicans, a lot of Democrats who want an income tax. I know this because during the CARC 12, trying to get us out from under Claremont decisions, I talked to a lot of Democrats about why they were voting against CARC 12. And 50% of them said they wanted an income tax. This was a route to an income tax. And that's not, because let me tell you what happens with an income tax. You know, one of the arguments you're going to hear is that, well, property taxes go down. That's the biggest myth. You all know about New Jersey, okay? In 1976, there was a Democrat governor who said he would not put in place any broad-based taxes. 3 years into his term, he convinced the people that we should do a 2% income tax. And that we would lower, and the argument was we lower property taxes. Today, New Jersey has the highest property taxes of any state tax rate, and I have the book here, I can show you. And has a progressive income tax that tops out at 9%. We got Massachusetts, there's an income tax and a sales tax, but they needed Proposition 2.5 to keep property taxes from increasing more than 2.5% a year. Once you open the spigot, money, there's no guarantee that money will be spent wisely. I like the fact that we're a local control, as much local control as possible, means your money gets spent better and more wisely than in other states. And by the way, our HHS budget, our Health and Human Services budget, these 2 years, that last year and this year, are still $2 billion a year. We have no problem, and I have no problem giving people a hand up that need a hand up, but not a handout. And we have the discipline not to make people dependent on government that shouldn't be dependent on government. I wouldn't give the fiscal keys back to the Democrats. I'm sorry, Trinka. We just return to the days of bonding operating expense. You know, one thing I was going to mention before is that, I got 30 seconds, is that we're paying, when we talked about reduced revenues, $43 million this biennium to pay for things that the Democrats did by bonding operating expense. $43 million that could have been spent on some of those programs, because what they were doing in those years was kicking the can down the road. So I'd like to say that I continue to be very responsive to the citizens of Stratham, as I have been these past 2 years, and again, it'd be an honor to serve you for another 2 years. Thank you.
I'm not going to go into the discussion about where the economy, our state is budget-wise between the Democrats and the Republicans. All I can say is go on the website, take a look yourself and see where we stood when the Democrats were there versus the Republicans now. What I do want to say is that I guess this is just a different philosophy that people have on how to balance the budget. For me, I think Republicans have always done a really good job of saying that Democrats just want to spend money. They want to give away the store. Reality is, that is the furthest from the truth. I believe in a balanced budget just like a Republican does. Because if we don't have a balanced budget, the first things that go are social programs that I do believe in. And I do believe in them because I don't believe, yes, there are people that abuse the system. Always is. That's what we're up there for. We're up there to put in legislation that every time when I was on Health and Human Services, I looked at putting in legislation that would reach the right people. That was important to me. Balancing the budget, it is what we should be doing as a society, is looking after and assisting the elderly and our children. And I just don't, I am very disturbed by where we're going by giving away back to the federal government money. With Health and Human Services, a lot of programs are matched funds from the federal government. When they cut those services, they didn't cut something by $2 million, they cut them by $4 million. That's what they did. What I'm going to do up there is I will look at not cutting something like a tobacco tax. And if I do something stupid, I will admit it and say we got to do something about that and not do it again. And put in legislation that will change that. You know, getting rid of I think was it 44 auditors that look into business taxes. Well, each one of those auditors would bring in $1 million, making sure that taxes were paid. That's $44 million right there. That's another thing that was done that I didn't agree with. So what I'm just saying is that, you know, I just like anybody else, when I see somebody walking in a parking lot and walking, using a handicapped parking spot, and they walk into the store and they look healthy as hell, I'm the first person to understand that majority of disabilities are unseen disabilities. I have to stop myself from making comments like that. It is not to have the philosophy that people are abusing the system and abusing the system and don't, they're going to get everything that they want coming to them, and that's not true. It's just not true. When you do help people, it makes a difference. And you know what? I've lived it. I've seen it in my own family. It really disturbs me on where we're going in this country when we don't think of it. And that's how we're thinking and where we're going. We got to do something about those people that are abusing this system. Yeah, there are people that abuse the system. We as legislators have to make sure we pay attention and do something to protect that. But that's life, and that's what people do. But do we make everybody else suffer because of that? I don't think so. And that's why I'd like to go back up to the State House.
Well, I'm the only thing between you guys and the door. So I will try to be too repetitive, but I do believe in being civil and working across the aisle. Actually, the day before yesterday, I was in Newfields at the corner of, I believe it's 85 and 108, and I was doing a sine wave with a Democrat for another office. It wasn't Patty, but at the same time, I think we'd be naive if we didn't recognize the fact that there's going to be disagreement. And in the end, we're going to make decisions based upon what we think is right. And one thing that I don't think is right, just to kind of capsulize on what we, at least the Republicans, talk about when we talk about the the prior legislature, that when the Democrats were in control, basically from the period of 2007 to 2011. I don't think it's right that we borrow money and take the state's debt from a figure of $654 million to $939 million. It's a 4-year increase, which was more than the previous 20 years. There's something, that's not going to work. And it was done under the leadership of the democratically controlled legislature. We see that going on in Washington, and I realize it's beating a dead horse, but I mean, it's, you know, debt is debt, and at some point in time, that's going to come home to rest, and someone's going to have to ante up. Just quickly would mention, we talked about education. I didn't specifically go into it, but one of the areas that I've really had a great amount of time, or spent a lot of time looking into, as a result of the publicity and a lot of the talk about the cuts that the UNH and the community college system took, is looking into that. I actually sat down with Paul Holloway. I've known Paul for several years, and I had the opportunity to sit down. He's the chairman, I believe he's the chairman of the community college system, working with Russ Gittel, who's the chancellor. And I had some very interesting conversations with him about things at the community college. Well, first of all, what the community college is all about. The fact that we have 27,000 students in the system, with 95% of them from New Hampshire, I think says something about the way that operation is going. There's been a lot in the papers over the time that I've been running. Most recently in the Herald, there was an article about I wasn't there, but there was an article, I think it was a gathering to recognize Governor Peterson and something he did with the community college system. But the folks from Albany International were there. These folks are expanding up in Rochester. And they talked about the fact that their primary draw here was the commitments they got to help with training by the community college system. The community college system's tuition is 1/2 of UNH. Now, I suppose somebody can explain to me, you know, why there's such a drastic difference between the two. But still, I think that there's some lessons to be learned there. I think there's some economies of scale. I think we all agree that getting funds back into those two systems is important. But again, I think we need to expect that. Well, UNH is talking now about freezing their tuition. The community college system has froze their tuition 3 out of the last 6 years. Now, UNH is coming forward and offering that up as I guess a chip to basically get back some of the funding that was cut. I mean, aren't those things that we could have been talking about before now? So I think that that's a big area, and it's one we're going to hear a lot more about. I appreciate you coming and spending the time. I know we went for quite a while. Of the 3 forums I've been at, I'd have to say that the questions coming out of this forum were very direct and very much to the point, and hopefully gave you a chance to see what we're about and what we're talking about, either continuing to do or talking about doing if we get elected for the first time. And I would just ask for your vote. Have a restful night.
Thank you, Bob, for the time this evening to come to this forum and participate, and thank you to the public for coming out and for your questions. Hopefully this has helped you make an informed decision on Tuesday. And again, we've polled, the newsletter has polled the candidates for our Exeter area offices and our Senate district on a number of different questions on education, right to work, social issues, etc. And those are all on our website at Seacoast Online if you want to check it out. There's an election button you can push on the website and it's all there. So hopefully this has helped you and you will get out and vote on Tuesday. And thank you for spending the night. I appreciate it. Thank you.